This is the Emergency Medical Minute, sponsored by Health One.
My turn. Is everyone listening very carefully? All right, so this is kudos to Emergency Medical Abstracts who brought this little article to my attention. So we not infrequently treat agitated people. I know that's a shock to you. And everyone kind of has their favorite drugs. You never know what they're going to go with to treat the agitated, like wild man in room 4A, right? So we'll take a little vote and see what everybody likes. Your choices are Haldol, Ziprasidone, Giadon, Versed. So we'll say, who goes with small dose Haldol? Anybody? Big dose Haldol? Big dose Haldol. That's a favorite. That's a nice one. All right. Medium dose Versed. No, and I should say these are IM meds, okay? Medium dose Giadon.
We don't use
Anyone?
Giadon anymore, so it must be the best.
All right, medium medium dose Zyprexa? Yeah, maybe. All right, so this is a really well-designed study. It's a Hennepin Emergency Department where apparently they see a lot of drunk wild men. They screened 3,400 potential wild patients and ultimately included 737, so a pretty big study. Not surprising that out of the wild people that presented there, the average age was 40, about 72% of them were male, and the reason for agitation was alcohol in 88% of their patients. So kind of similar to what we see, right? So then they randomized in 3-week blocks. They gave people either low-dose Haldol, high-dose Haldol being either 5 or 10 milligrams. They gave them Olanzapine, Zyprexa, Ziprasidone, Giadon, or Versed. So they compared 5 different drugs. And then they had a paid study associate who would come at 15 minutes, 30 minutes, 45 minutes, 60 minutes, 90 minutes, 120 minutes, and just sit there and observe and see how agitated they were. And they had an official scale called the AMS scale that they rated them on. So anybody guess out of all of those drugs, what medication was the best at taking care of kind of wild man? Versed. So the main outcome they were looking at was 15-minute outcome, because who really cares if they're sedated 120 minutes from now, right? What we want is some peace right now in room 4A. So actually, Versed was the fastest onset, had the greatest efficacy at 15 minutes, followed closely by Giadon, Ziprasidone. And so Versed and Giadon were the 2 best out of all of those medications. They had hardly any adverse side effects, but the study wasn't really big enough to pick up on those. So their recommendation was, if you want to go fast, either Versed or Giadon. So that's it. So you can use that tonight. Dose of Versed was 5 milligrams Versed.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.